following is a production of West Virginia Public Broadcasting.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University. Welcome to Doctors on Call. Tonight's topic, children's health. Two experts are here to answer your questions. Now here's your host, Dr. Joe Prudhomme.
Good evening, and welcome to our 20th season of Doctors on Call. Thank you for welcoming us into your homes for so many years. Tonight's topic is children's health. You know, with kids, it's always something. Colds, earaches, tummy problems. But what if it's more than just sniffles? It's not something we like to think about, but children can have serious health issues too, like heart problems and cystic fibrosis. Or they can share serious diseases with each other, like meningitis. How can you tell when your child is seriously ill? What are some of the common pediatric infectious diseases to look out for? How can your child's heart condition be treated? We'll get the answers to those questions and more tonight from our two guests. And they're familiar faces to those of you who watch Doctors on Call regularly, two of our other hosts. But tonight they'll be answering your questions instead of asking them. Dr. Kathy Moffitt, a pediatric infectious disease specialist with WVU Children's Hospital, and Dr. John Phillips, a pediatric cardiologist with WV Children's Hospital as well. If you'd like to ask our guests a question, give us a call. Our phone lines are open now. Kathy, among other things, you're an expert on cystic fibrosis.
Right.
I know that's a really challenging disease that they've made some inroads in since I was a med student. Tell us a little about that.
Yeah, it's an inherited disease. There's a problem with the salt channel, and salt can't get out of the cells, and so mucus is thick and sticky because water stays with the salt in the cells. There actually has been a breakthrough. First of all, we're doing newborn screening, so all babies now for almost 4 years get screened for CF. And there's a new drug that only works for 5% of the population, but is about to be FDA approved probably next month, that actually helps that salt channel open and work better. So it offers real hope for those patients and for all the other patients that there's a breakthrough. Maybe they'll come up with they're working on some other medicine that will help maybe all patients. So it's pretty phenomenal.
That's fantastic. That's really good news. John, I know your thing is hearts, it's children's hearts. Some kids are born with heart disease and some kids develop it. Tell us about the difference between those two kinds of heart problems and what we should look for in our kids.
Sure, that's right, Joe. It's a lot like cystic fibrosis. About 1% of children are born with heart defects, whether they be something very mild that doesn't require treatment or something more severe that may even need surgery. And it can affect anybody, honestly. And then as they get older, they can acquire cardiac defects, just like adults, whether it be infection or just damage to the vessels and such over time from poor health.
I know there's a big controversy among sports medicine, which is something that I deal with, about whether to screen kids for heart problems when they're going to do their sports pre-activity physicals. Okay. For the kids who are at risk for sudden cardiac death. What's the current state of the art on that?
Well, right now in America, we still just do a routine pre-sports participation physical, but there is a lot of discussion, particularly among my colleagues, about how much we should do here in America. For example, in Italy, hypertrophic cardiomyopathy, which is a congenital abnormality where you have a thickened heart and leads to sudden death, is the number one cause of sudden death in athletes in America. Well, it was in Italy, but in Italy they screen all of their athletes at whatever the similar NCA level would be in Italy, with an echocardiogram and an electrocardiogram. So hypertrophic cardiomyopathy is no longer the primary cause of sudden death in athletes. So we're getting there. We're really moving towards at least doing an EKG, but there's a lot to consider. You can do an EKG. There may be mild abnormalities that would cause anxiety, may even keep a child out of sports participation when actually they didn't need to because they don't have a true genetic abnormality. So at this point, what we recommend is you get a good physical exam, a good family and personal history by your physician before sports participation. And then if there are symptoms, they'll refer you to a cardiologist.
Great. Sticking with the sports and physicals, because that's an interest of mine, being a little bit selfish here, but exercise-induced asthma is another thing that's changed a lot in the last 10 or 15 years that we're recognizing a lot more and treating more. Right. Tell me what we do for kids who may have asthma when they want to play sports, and what's the
I think it's a lot of, again, like John said, taking a good history, finding out what are the triggers for kids. If it is sports, then figuring out are there controller medicines they can be on? Do they need an inhaler before sports to participate? And so we understand that actually exercise is good for kids, even kids with asthma. So keeping them active, but really evaluating and trying to figure out the triggers and maybe reducing that risk.
But we can usually make them able to play, with
right.
their medications.
Right, even kids with CF, with chronic lung disease, exercise is good for them. So I think that keeping our kids active, I actually saw something that the AARP said that sitting is the new smoking for now a generation. I kind of like that, but even we could start young with our kids that, okay, they're not going to smoke, but we don't want them sitting either. We want them active.
And the same goes for kids with congenital heart disease. Even if you had surgery, it doesn't preclude you from playing sports. And you need to talk to your cardiologist about what they'll allow or not. But for example, with me, I'm pretty liberal. I let almost all of my kids play all sports. The biggest restriction that I'll have is weightlifting, truly competitive weightlifting. And it's not the football that hurts the kids playing football, it's weightlifting associated with football. So even if you have a significant heart defect that required surgery, I'm gonna let you play. Now, I'll certainly let you play outside with your family and friends around the block because that promotes health, right? We don't want them sitting around playing video games all day, getting overweight, having high blood pressure and cholesterol on top of their congenital heart disease. So I let almost all my patients play.
Great. Hey, folks at home, we'd love to have your phone calls. This is a live show, and our phone lines are open. We'll put the number on the screen for you. And please call in with questions for us. It doesn't have to be about you or your kid. You can call in with questions about your grandkids. But we would love to talk to you about children's diseases tonight and help you with anybody among your family or friends who might have a question. The other thing that I find interesting is this. Having moved here from Texas, I think I have the reactive airway disease. It's not really asthma, but when I go outside now and it's cold, I find that I get a little choked up changing temperatures. What's that about?
Well, I think that we know that there are other things that besides just having maybe a true diagnosis of asthma. There's pollutants in the air, the cold, so the change from being in warm air to cold air, or in the summer from being in a nice environment and going outside when it's really humid can really constrict those airways. Pollutants and pollen, even if you're not allergic to the pollen, if the pollen count's high enough, it can really be irritating, just like cigarette smoke is irritating to us. So there are a lot of things, even if you figure out that you don't actually have an allergy, that are weather related, that can be a trigger.
Is that common or uncommon?
I think it's very common.
I have it, but it's just in cold, specifically just in cold weather that I get it. But one of the other things to mention, and it's kind of fun because we're going back and forth between hearts and infectious disease, is when you have the symptoms that you're talking about, often chest pain is what the kids will complain about. And of course, we're all worried about chest pain. Is it a heart attack or not? And I think it's important for our viewers to know that chest pain in children is very, very common. It's very uncommon to be due to the heart. Only 1% of all chest pain in children is due to the heart, and the majority of those are abnormal heart rhythms. So it's exceedingly rare for a child to have chest pain due to a heart attack or coronary artery disease. The majority of the times what it is musculoskeletal pain. Each rib attaches to your breastbone is a little joint that could become inflamed. Grandmas call it growing pains. And as they do their different activities, that can hurt. You could have pulmonary problems like we're talking about, asthma, reactive airway disease, allergies. You could have gastrointestinal problems, heartburn or reflux, indigestion, all those. And then the fourth one, very common in teenagers, is hyperventilation. So they have a typical chest pain, growing pains. They think they're having a heart attack. They start to hyperventilate. They can't catch their breath. Their fingers begin to numb. And sometimes they pass out. So chest pain is not uncommon in kids, but it's very uncommon to be due to the heart.
All right, we've got a caller on the line. We have Gay from Pikes County, Kentucky. Gay, ask us your question, please.
Yes, my grandson is 5, and he developed juvenile diabetes. It's been about a year ago, and I just wondered if this will affect his heart.
All right.
Right.
So you want to take that one, or do you want to give it to John?
So I would assume that her grandson being 5 is probably a type 1 juvenile diabetic on insulin. And we know that microvascular disease, so the really small vessels, the arteries in our body, can be affected over time with uncontrolled diabetes. And so the places that get affected are the hands and feet, the kidneys, and then you can also have heart disease. So the bigger vessels leading to coronary artery disease. So probably not in the next 10 to 15 years, but as he ages, he really good control of his diabetes, and then really being monitored very closely with his physician's eyes as well. I forgot about the eyes, kidneys, eyes, feet,
Well, that's
and
right.
then the heart.
And it's most likely type 1 at 5 years of age.
Right.
I think sometimes what we worry about is we hear about older folks who have coronary artery disease and diabetes, and it's true that there is a correlation
Right.
between obesity, hypertension, high cholesterol, sedentary lifestyle, and smoking that leads to coronary artery disease and also to diabetes. So they are combined, but the juvenile form of diabetes is a little bit different than that.
Right.
But Kathy's absolutely right. If you're in good control, you're decreasing those risk factors as you get older. And that's important to mention. And we screen children. Your child should be screened by about the age of 6 to 8, for high cholesterol.
Right.
And it's not that your kid's going to have a heart attack by the time they're 15. But it's important if you know that they have high cholesterol as a youngster, and we start treating high cholesterol, obesity, hypertension as a child, then when they are 30 or 40, they're going to be that much healthier.
Having the lifestyle and
That's
the
right.
right choices and getting them used to the right choices at a young age is really a really important habit.
I think that's key. Well, thank you for that question, Gay. That got us started in a good avenue, and good luck with your grandson. Let's take a call from Alan in Wood County. Alan, ask your question, please.
Yes, I have a wood-burning stove, and I was wondering, I have a young child also, and I was wondering how bad is the wood-burning stove smoke? I know secondhand cigarette smoke is bad for a young child, but how bad is the wood-burning stove smoke for a young child?
How well is your stove ventilated, and what kind of material you burning in it?
Just regular oak wood, okay, and it's ventilated well. But when you do open it, you do get some smoke, from coming out of it. And I was just wondering, could that be harmful, or is it bad on a child, that smoke from a wood?
All right.
Yeah, those are really good questions. We know, just like he mentioned on the phone, the cigarette smoke. The smoke is in the house, and there's particulate matter, and some people can smell it, some can't. But that is an irritant. So it is like being around. It's a particulate matter, and so if you have allergies, if you have asthma, and it's something that should be avoided. So I think looking at what are their risks, and is there an alternative heat source? Some people
In the
don't have
absence
a
of
choice.
allergies, it's probably okay.
Right.
Then, particularly if it's well ventilated. And trying to pull from my general pediatric experience, really what I thought about when he brought it up is nosebleeds. And I know we're taking it in a different direction, right? But folks who have wood-burning stoves have very dry air in their house, so often complain that their children have a lot of nosebleeds.
Right.
So it's really important, particularly with a wood-burning stove, to add a cool mist humidifier, at least to the child's room or maybe to the whole house, that you do need to change every day. You can't leave the water sitting in there. You need to change the water out. But it's important to humidify the air to decrease things like
They
nosebleeds.
also do have those metal or cast iron things you can put
cast
on the
on top.
stove.
Put on top
You got to
of the
be
stove.
careful though about burning, because if they get that close, you need to worry about them not getting burned by the stove. But the humidity. I mean, that's why we all get dry skin, and a lot of times you get itching, and because there's so much less humidity in our houses in the winter, so particularly with the wood stove.
So there's basically three problems with it. One, if it's not well ventilated, you can kill yourself with the carbon monoxide, and that's the imminent problem. The particulate debris is potentially a trigger for asthma, reactive airway disease, but it's also, just like the particulate debris from cigarette smoke, is carcinogenic. And that's something that, while we're talking about the secondhand smoke, cigarette particulate debris gets in your clothes and in your car and stuff like that. So even if you're not smoking with your kids in the car or smoking with your kids around you, the particulate debris from your cigarettes on your clothing and in your car seats and in your furniture in your house is dangerous for the children.
It's very important.
And
it's a huge list.
It's very clear that children who live around secondhand smoke, even if they're not smoking in the room with them, have more respiratory infections, more ear infections, more asthma, in utero. So if a woman smokes when she's pregnant, there are just real risks. Lower birth weight, which puts a baby at risk, and asthma. And so even the smoking outside, it's there. You're bringing it in, and so for a person's health, they should quit, as well as for their kids. Absolutely.
Right on.
That's a tough one. It is a tough habit, but it's worth it for everybody.
Our next call is from Bob in Fayette County, Pennsylvania. Bob, ask us your question, please.
Yes, doctors. Thanks for taking my call. Yes, I have a daughter that was born about 3 months ago, and the doctor, he thought it might be a possible heart murmur. So he sent her to UPMC in Pittsburgh, and the specialist saw her and told my wife that treat her normal, and he'll see us in 6 months. But my wife, she doesn't really explain it well, and I thought maybe you could explain me what it is generally, and maybe what possibly happens in the future, generally to most people.
All right, that clearly sounds like yours.
It's a little girl.
A little girl.
Congratulations on your daughter.
Well, a heart murmur is a sound of noisy blood flow going through the heart. It's very common in small children to be able to hear normal blood go through the normal heart. That's called an innocent heart murmur. And about 85% of children at some point in their childhood, you will be able to hear, or their physician will hear, a heart murmur. So it's just that our stethoscopes, when we listen, are so close to the heart, you can hear the normal blood going around in there. Now, sometimes children do have abnormal valves or little holes in their heart that could cause an abnormal heart murmur. And it really is up to your physician and your cardiologist to determine whether it's truly abnormal or not. But the fact with Bob's child, it's okay that she's just being followed, because most of us, we're pretty good at being able to listen and distinguish abnormal murmurs from normal murmurs. And sometimes we're not so sure at 3 months. So what we do is, as long as the child's eating well, gaining weight, not having symptoms, and symptoms in childhood would be poor feeding, it's okay. So bring them back at 6 months, we'll listen again. If the murmur's gone or it's changed, it's more likely to be an innocent murmur. It's important to note that those types of innocent murmurs are going to be more common when you're sick, if you're dehydrated or if you have a fever.
Right.
And then others just occur even during well times.
And so his wife, though, should talk to their pediatrician or family, the baby's doctor, and say, what did they say? So she's not laying there at night, because we all do that as parents. I know I have with my own kids. I think, oh, is this real or not? And I think, come on, they're healthy, they're fine. But we all do that. And so she needs to be reassured that her daughter's okay.
It's a great question, though, because a lot of people think, I have a heart murmur, I have a heart defect, and that's really not true. It's truly not true.
Well, and Bob, we're really happy for your new baby, but you should never feel bad if the baby doesn't seem well to you, and you think that they're not growing and gaining weight and eating normally. There's nothing wrong with getting rechecked and allaying your wife's fears. But maybe, as Kathy said, your pediatrician might be perfectly capable of doing that without having to go back to Pittsburgh to the cardiologist. You should ask and not lay in bed and worry about it. Though.
And they are. I mean, if 85% of children have heart defects, heart murmurs, I certainly don't see 85% of all children. So the majority of children are screened out in their pediatrician's office for true abnormal innocent heart murmurs, and our pediatricians throughout our country do a great job at that.
Right.
Congratulations on your new addition, Bob. That's really nice. One of the things that you hit on earlier is something an orthopedist is a concern to me, and that's the indoor sitting disease you talked about, where the kids just stay and play video games. They have now said in orthopedic literature that 30 or 40% of kids at least are vitamin D deficient, and to the point that they're starting to get rickets again, which went away in the 50s, almost didn't exist anymore from not getting enough sunlight. So much staying inside and slathering in sunscreen when they go outside, that they're actually getting vitamin D deficient rickets. I mean, that's...
Well, and the other thing is our dietary habits. So kids don't drink milk. And so the calcium intake where you do get fortified vitamin D, you're not getting the vitamin D outside. So many of us, even adults, are vitamin D deficient. So it's real concerning. We need to look at all these video games. Are a tough thing.
And it ties into the AAP's recommendations of every child should exercise at least 5 times a week for 30 minutes, increasing their heart rate. It's not enough to say, I walk to school. People say, I walk to the store all the time, I do this. You have to play or exercise for 30 minutes with keeping your heart rate sustained elevated. And same for adults and adolescents. Actually, if you want to lose weight, that's the way you do it. It's not enough just to walk to your work or around the mall or whatever. You need to get your heart rate up and have it sustained for at least 30 minutes to start losing weight. And then you have to, particularly in kids, you need to cut out the sugar drinks.
Right.
Okay. That's the biggest problem. And as I think most of our viewers know, about 60% of our children in West Virginia are officially overweight. I mean, that's an enormous amount. And sugar drinks are the problem. Now, we've got rid of most pops, I think, in schools.
Right.
And my partner, Bill Neal, runs the Cardiac Project, which screens children for coronary artery disease at an early age, doing great work there. But it's important for the parents to hook on to and help.
We got somebody else at home with a question. We got Ronnie from Tazewell County, Virginia. Ronnie, you ask us your question, please.
Yes, I was wondering about, wanted to ask one of the pediatricians. My grandson, when he was born, they got is what's called tongue-tied, and they did not see that. He was premature, and in the NICU center, they did not see that, and they should have clipped that. I'm not sure what you call that piece of tissue or meat that holds the tongue down to the bottom of the mouth. And now they said, one doctor said that he would outgrow it. He does have a speech problem. They say he will outgrow it, but then we have heard that some say that no, that he could go in to see a pediatrician and they would clip that now. But then we have heard also that that's a traumatic surgery for a 6-year-old. What should we do here?
Hey, Ronnie, so you said your child is 6. Are they otherwise well? Any other health problems at all?
No health problems at all.
Okay, perfect.
Grandson. Yeah, so it's the frenulum. That's the little piece there that Ronnie was talking about that is a little longer and can keep the tongue. You can't get it up to the roof of the mouth. It can make it trouble for a baby to latch on and breastfeed or to feed with a bottle. I'm surprised they didn't clip it. And I guess I'd go back to the pediatrician. Usually I've never clipped one. I've sent them to the ear, nose, throat folks. And with young babies, it's more scary, I think, to see that they're going to do it. But once they do it, it's literally like that and it's done. So I think talking to the 6-year-old and seeing, if it might help.
I think there's a spectrum too of tongue-tied. So if you have severely tongue-tied where you are having speech impediment, or in an infant where you're having trouble eating, then sure, you need to do it. Now, if Ronnie's grandson is 6, he hopefully has grown pretty well. He's 6 years old, out and playing. So he may not have had as severe a tongue tie as some other kids. Now, if he has a speech impediment, I think he said he may have, then that's something that a speech pathologist should take a look at, and they may recommend to go ahead and have it clipped.
And clip it.
And that's exactly what I was thinking, Ronnie. That would be my vote, is to have your grandson see a speech pathologist, and they can evaluate, like John said, whether this is going to help or not. But I wouldn't be scared of the surgery. I'm the surgeon here in the crowd, and I will tell you that children heal very quickly. The tongue is a really quick healing part of the body, and it might be a tiny bit more painful at 6 than it would be as a newborn, but it's still not a big deal, and you shouldn't be frightened of it. It's a very, very easy procedure to do, and if it would benefit him, you should by all means look into it and go ask him. It's not a big deal.
A 6-year-old boy most likely may have already had more stitches and more pain than it would ever cause getting your tongue
Tongues heal really
Right.
fast. Well, good luck with that, Ronnie, but please get it checked into. Have your grandson see the speech pathologist.
Yeah.
All right, we got about a minute left. Anybody got a parting?
So we need to mention that there's a new recommendation for entering 7th and 12th graders this coming fall. Those who are going into 7th and 12th grade need to get their Tdap, which is pertussis, tetanus, diphtheria, and their meningitis shot. So those kids who are in 6th and 11th grade right now need to get their vaccines before they enter school. And about half the kids in Mon County have had them done. We just looked at these. You can get on the Mon County website here locally. I think you probably can get on your school websites and look at that and find what form. Go talk to your doctor. And that means that this year's 5th and 10th graders need to think about getting vaccinated in the next year, so when they enter 7th and 12th grade. But it's a new state of West Virginia recommendation, and I think it's falling in line with what nationally we're realizing kids need their boosters.
All right. Well, great. That was a nice start for our 20th season at Doctors on Call. It was fun for us three all hosts to take care of you, and we've been talking tonight about children's health with Dr. Kathy Moffitt and Dr. John Phillips. Thank you both for being with us. If you'd like more information, talk to your family doctor or visit our website at wvuhealthcare.com. For Doctors on Call, I'm Dr. Joe Prudhomme. Good night and good health.
Join us again next week for another edition of Doctors on Call. Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
This has been a production of West Virginia Public Broadcasting.